Welcome to the Capital Integrative Health Podcast, a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. I am Dr. Andrew Wong, co-founder of Capital Integrative Health, an integrative practice committed to expanding access to holistic root cause medicine to the global community. Today we have our friend and colleague, Dr. Hiza Mbwana. Hiza is a doctor of physical therapy specializing in helping clients recover from injury, address acute or chronic pain, and restore optimal function. He is passionate about helping his clients reach optimal wellness by addressing the whole body. We are lucky to have Hiza here at CIH to provide physical therapy to our patients. Hiza enjoys living out health and wellness in his own life and spends his time trail running and cycling and doing other quality family activities with both his family and his friends in the DC area. Join us for a conversation today about addressing physical pain in a holistic manner and bringing back optimal function and wellness to body, mind, and spirit. Welcome, Hiza, to the podcast.
Thank you for having me. Appreciate it.
And I will say this is the very first podcast we've ever done on a Friday, so
Ooh,
this is very groundbreaking
man.
and pioneering here, like one of your trail runs, I believe.
Well, I hope I don't break the process.
It's always good to go a little off track,
and
we've done that a little bit before we got on air here, but we talked about tacos and how we really enjoy, looking at the best taco places in the area.
Yes, I think we have a lot of work to do. I mean,
there's a lot of exploring.
Yeah, we've only covered a small fraction of it, and I think there's room for improvement.
So we'll get back into that as that relates to physical therapy and different health issues. Let's talk first, though, about kind of your background and how you got. Why did you pursue physical therapy as a career, and did you have any experience that led you to want to work professionally in the health and wellness field?
Sure. Well, I guess I kind of got to it in a very direct way. So growing up, one of our family friends, so I moved here from Tanzania, and when we moved to the States, we had a family liaison person, someone who kind of helps you integrate with American culture.
Yeah.
And so I call her my Aunt Sarah. She would literally every weekend she would pick us up and take us to explore different things, whether it's horseback riding, swimming, anything. But she also happened to be a PE instructor she taught at Ithaca College, and they had a human performance lab there. And they were looking at CO2 max variabilities, and they were looking for younger population, younger samples. And so she would volunteer me. I would go. I would participate. I'd wear this giant, mask and get on the treadmill, and they would do all these different tests. And then afterwards, we would go to Ponderosa or something like that and just, have a huge lunch. But then, So that's how I got into. So my experience or my exposure with performance was pretty early on, just from being part of that environment so often, and then seeing, coaches and seeing athletes in there also getting rehab or athletic trainers working on athletes. So, so part of it, she was also a big fan of gymnastics. And so on Friday nights, they would have gymnastic meets there at Ithaca College. And so we would go. And for me, I wasn't really interested in, the actual performance itself. I was more interested in how do they get to that point, right? Mm-hmm. How do they do the tumble? How do they do these flips? How do they do that day in and day out? And why are some wearing, ankle wraps, and why some aren't wearing ankle wraps? And so again, that's just the way I thought of it. I never looked at it as, I'm going to gymnastics, I'm going to watch a show. So that happened. That I guess that's kind of how it's always been for me. Is like I look at performance, but really the behind the scenes stuff.
What led to that?
Yeah,
kind
what
of the
leads
root
to
causes.
that? So for me, I've always kind of looked at it like that. And then in high school, I had a really bad ankle injury, and that was my first exposure to physical therapy. So it was a pretty bad. I torn a couple ligaments. So the options were physical therapy or surgery. So surgery for me wasn't an option because they said I wouldn't be able to play within the next year. So they said if I do physical therapy and everything looks good, I'm able to get back to playing in 8 to 10 weeks. So I was like, I'll take 8 to 10 weeks.
Yeah.
This is fine.
A lot shorter than a year.
A lot shorter.
Yeah.
So I ended up hanging out with this physical therapy group for the entire time. And then after that, I really fell in love with the profession because it was also around the same time my parents were saying, you should think about what you want to do for college. You're not going anywhere undecided. We'll tell you that right now. So think about it. So I realized, I was like, well, I really like physical therapy. I had a great time in physical therapy. So why don't I explore that? So I volunteered my time after school, after soccer practice. I would volunteer my time at this same physical therapy clinic throughout my high school.
Nice.
Yeah. So every 3 or 4 days a week, I would be there every single day.
Not nice. So you've really been a physical therapist in training for a long time.
I have been for a long time.
And just to go back to Ithaca College and the HPL Human Performance Lab, how young were you when you started doing that?
I was 9.
Wow. So you really have been.
I was 9.
Amazing.
And so I've always been around that environment.
Yeah.
So but again, I think for me the main thing was really I enjoy the most how things work, how people work, how the body functions, and how it kind of bounces back after injuries. So I've always been keen on that. But I think my Aunt Sarah really helped really kind of solidify that, because I didn't really have an idea of what I wanted to do, but I think her exposing me to that
at
environment
a young age,
it kind of was kind of a pivotal point for me.
And then in terms of shadowing different PT practices, etc., did you learn different nuances to treatment and those type of things from there?
You mean after?
I guess even in high school, but then afterwards, of course.
I think in high school, I wasn't at a stage where I can actually appreciate nuance.
Okay, right.
But I think what I definitely knew that was different in this PT practice compared to another physical therapy practice that I ended up going to was, the first one is I had a lot of fun. It was a lot of fun, even though I was doing rehab. They knew they were working with an adolescent. He's not going to just sit still and be worked on and be told and be educated like, oh, well, this is what's happened to your ligament. They just made it interactive. They made it fun, and they made it unique to me, and they made it specific enough that I felt like this was the only person that can do this is me.
And physical therapy is one of those things that it seems like you just said, the only person that could do it is you, and you kind of have more domain over that, almost like taking charge of your own health that way, and that's a really nice thing there.
Yeah, and I think that's the first thing. I guess if I had to identify kind of the early nuance in terms of physical therapy for me, was that the body is capable of doing, and you are a lot more in control than you think, and I think that was the main takeaway that I got from my early days, is that you're definitely not limited to just your current circumstances.
And we know that mindset has a huge role to play in the physical functioning, recovery, the body. I do want to get into a deep dive in that a little bit later here.
Sure.
But first, let's talk about more broadly, how did you come to work with us here at CIH? How did we meet? I know we should give a shout out to Bonnie, our
we should
good
give
friend
a shout
Bonnie
out,
here.
Yep, to Bonnie. Yeah, but I think, and Mike.
And Mike, yeah, absolutely.
I think the first time I heard about you was you worked with my colleague, Mike.
Yes.
Because he had some unusual thing. It started out with, I think it was, I remember. He said that he'd been drinking a lot of French press coffee.
Okay.
And I think you identified something about the French press process was affecting his performance, and so you had him change up and change the kind of coffee he was drinking, and he felt amazing and he felt great, and so at the time I was also looking for primary care, and he's like, you got to talk to this guy. and I was like, well, where is he? And he goes, upstairs
in the building.
I go,
same building,
great, the path of least resistance.
Convenient.
He's right upstairs.
Yeah.
And so I think that's when we first met, and then subsequently I think we figured out that we were neighbors.
Yeah.
So
very
every
close
once
by.
in a while we would kind of be in passing, and it's like, I think that was Dr. Wong. And I was like, I'm pretty sure that was him. But again, I was like, who would? And then eventually I was like, do you live in the area? He's like, yeah, I live right over. I'm like, oh, yeah, you live right across the street.
And that's the beautiful thing about like meeting people, like, cross pollination. And, I think we're both interested in how we can take a holistic integrative approach to care. And that's how I think we kind of bonded too.
Yeah, I agree. I think that was the main, when I decided to start my own practice primarily because of that.
Yeah.
Was that I looked at physical therapy as a lot bigger than just, knee pain or back pain or shoulder pain. I looked at it as really, this is a whole system process, and the current mechanisms weren't allowing me to explore that process.
Right.
So instead of trying to fix the system, I just started my own process.
You started Chembio Physio in which year
in
again?
2013.
2013. Okay, so it's been 9 years now. It's
so
great.
2013. I remember telling my patients, like, oh, it's going to be very different. I just don't look at this. We're going to target all these other areas. We're going to talk about, sleep habits, and we're talking about, again, at that time, I had no idea how intricately related these things were, but I just knew that for most of my patients, stress was a big factor of pain. And, in the traditional setting, patients come and go, but for the most part, the prescription was 2 to 3 times a week for 4 to 6 weeks.
Yeah, and I just remember meeting you and talking with you more in depth, over a cup of coffee or whatever.
Yeah.
It's like, talking about stress and mindset and sleep and nutrition and all these things that I've never heard a physical therapist talk about that before. So I was like, this is someone special here.
Yeah. Well, I owe that a lot to just being, lucky enough to be in an opportunity to learn from different people. And I think that I learned from my patients more than they probably know. And, you start to see a pattern with a lot of performers that, if they're all exhibiting similar stuff, it can't just be ignored, right? It's not just something that you have to at least try and tackle it as much as you can. And I think that's part of the reason why we connected and resonated so much, is that I think we saw practice, medical practice as a lot more robust than, just, input, output. It's a lot more complex than that, and it's individually based, and it's not just, if you just do this, you'll be fine.
Right. And absolutely. And I would also add that, as you just mentioned, that patients are our best teachers, right? And part of it's about, listening to them as they cultivate and develop that innate healing for them.
And and I think that is the hardest part for providers in general, because that means you have to trust them, right? It's no longer based on your skill set, right? Your job is to be a nudge, a gentle nudge. It's up to them to do the hard work, which is, finding clever ways to get around their limitations, finding ways to move beyond that. And I think that's the hardest part, as being on the sideline waiting, right? Yeah. Because you want it to go, you want it to happen. But, I think what I've learned in this whole process is that you have to step back and you really have to let them do it. It might be a week, it might be 10 weeks, but it's really up to them to work through that. And it's not healthy for you to be kind of chomping at the bit and waiting. And it's not your job to take credit for their progress. It's your job to be a cheerleader. And I think that's what I've learned the most from, having started my own practice, is that I stopped caring about the PT part, and I cared more about the outcomes. And the outcomes are really, do I feel resilient? Do I feel confident? Do I feel educated? Do I feel knowledgeable in what is happening to my body, and how do I move beyond that? And I think that's the hardest part, because it involves you trusting the patient to do for themselves.
Yeah, and building up that trust probably week after week over time is one of the big, I think, mechanisms of healing. As a physical therapist, what are your primary goals when working with a client?
Great question. I think for me, again, it's going to sound a little off base, but for me, my patients need to have fun. I mean, I think this is not something that a lot of clinicians think about, but
I totally agree.
having fun and being able to joke and talk about things that are serious, but at the same time, give them positive optimism is critical in this process. I mean, like I always joke, I always say, "Hey, how's it going?" I go, "Wait, I know you're here." The only reason anyone comes to see a physical therapist is not because they're feeling 100%. It's usually there's something going on, right? So no one really comes to hang out with you because they're like, "I feel great. I'm walking on sunshine," and so they're already feeling some kind of way about themselves, and so I think the most important part of my job is to make sure that the environment is engaging, but also that it's lighthearted and it's educational, but it's got to be lighthearted and fun, and it's got to give them purpose and education.
It's positive reinforcement. We tend to do things more and repeat them if we enjoy them.
Yeah. And also, I mean, most people understand from a kind of an oversimplified version of what's going on with their bodies. So if you try to go into the minutia of what's going on, that's great for your colleagues. That's great for, if your patient is well versed in the medical field, that's fine. But most people want to know, how do I get back to doing the things I enjoy doing? Right?
How do I feel better? How am I more functional and stuff?
And how do I find ways to continue to spend time with my family? How can I get back to playing with my kids? How can I get back to picking up my grandchild? How can I get back to riding and enjoying
would you say the primary goals would really be, it's very patient-centered actually? It's like kind of what they want to do to be more functional, enjoy their life more.
Yeah, I think it's really centered around that, and it's taken a lot. It's a constant struggle because it's my bias is always to fix, right? But that's not
how we're
our
all trained, right? And traditionally,
we've always been trained to fix, but I think changing and learning to be an educator and creating a fun environment that's engaging has been one of the best changes for me, because it makes the medicine go down a little smoother.
Yes, exactly. A little honey in there.
Yeah, a little honey in there.
Nice. Maybe some herbs as well.
Right.
Just got into that. So what are some common themes you see arise with clients? I guess both opportunities and challenges, I would say.
Well, one of the most common theme I see is the prevalence of chronic pain.
Okay.
That's taken a huge rise.
And we know about the opioid epidemic and all this stuff. We're trying to get
so I've seen that be kind of the one of the primary things that contribute to a lot of ailments is the severity of chronic pain, the frequency of chronic pain, and all the subsequent physiological changes and psychosocial changes that take place. That's been a huge shift, because I remember a decade ago, I mean, most of it was evaluate and treat knee pain. Yeah. That's it. Evaluate and treat this. And now, I mean, and I look back and I realized, obviously you can't rewrite your past, but you realize how many of those people weren't there because of knee pain, but they were there of something a lot more profound and a lot more nuanced than just kind of a plug and chug kind of response.
Pain is a mind-body condition for sure, but let's take a forest view, a step back if we can, and let's just talk about pain and like the definition of pain. What is pain? Is pain always bad? Because I feel like even the word pain connotes something that is negative. Yeah. And one of the things that I always sort of say sometimes to patients anyway is, sometimes symptoms are our body's way as our friend to notify us that, hey, something is off kilter, out of balance. So then gives you an opportunity to notice that and then to maybe do something to bring that back to equilibrium. So what is your definition of pain? How do you see that?
Well, I haven't experienced or worked with a mixed patient population, some who have pain from post-op, some who have chronic pain, and some who have kind of something in between from either sprain or strain, is that pain is unique to the person. And pain is more of an experience rather than kind of the traditional binary thing, is either is there pain or is there no pain. So I look at pain as really it's a personal experience for that person, and it's mixed with past experiences, it's mixed with past responses, it's mixed with it's a lot bigger. It's a personality, right? So and certain cultures, I've learned to appreciate certain cultures have different ways of interpreting pain. But again, what's unique is that even in those cultures, individuals with pain have a unique response to that pain, and it's a relationship that they have, and some hold it as a badge and some people don't. And I think having respect that it's a little different than...
I have a question, just off tangent a little bit, but you know, in terms of that Tanzania, other places around the world that you've kind of experienced, any difference in the sort of the way that people there, you know, you would say, experience pain versus like people here in America?
Well, I think, not to generalize, but I think for the most part, for me, in my culture, pain isn't really looked at as something that needs a lot of attention.
Okay.
Right. Pain is really, if you get an injury, you move on. And I suspect that some of that is really, we don't, growing up or just lived experiences, there are so many other things that are more pressing in my country that you don't have time to actually pay attention to the subtle nuances of chronic pain.
Are there physical therapists?
There are physical therapists, and most of them work with fractures, injuries, etc. But I think that the idea of chronic pain being unique and individualized, I think that's an emerging mindset, because it's from countless work of psychosocial therapists and just looking at different ways that different cultures interpret pain. And I think that's been the biggest challenge, is that I see pain as a unique experience, and a lot of my colleagues and a lot of other people look at pain as this kind of input output, and it's just you just have a neuro issue that needs to be resolved, or you just have this injury that needs to get
mechanically
better. Right. But I think looking at it from the psychosocial perspective has really changed my mind. And again, I think even looking at the way pain is handled in Tanzania, it's really psychosocial, right? So for a lot of people, they are dealing with so many other things that are so much more pressing,
urgent,
and urgent that I think there's a certain level of robustness there that comes with that. So I suspect that there's a certain level of tolerance too, in terms of the neuro response to
challenges
stress
create
too.
resilience.
And I suspect that's probably one of the the differences that I see. I think as a nation here, we look at pain where the level of resilience isn't as much, because there's a lot of fixes, right? You have a slight ache, there's a med for that. You have a slight sneeze, there's a med for that.
Pharmacies open 24/7.
Pharmacies open 24/7. And so there is a level of, it creates a mindset that I can just turn this pain off immediately. I don't really need to work through it. I don't really need to experience that. And the challenge is that when that happens in adolescent, it's really tough to be resilient and have that resilience in your 40s, 50s, 60s.
Because the brain pathways haven't been developed.
Because the brain pathways have not been developed.
Yeah.
It's just like doing anything challenging.
Yeah.
It's scary at first, and then you do it. You go, oh, that wasn't so bad. But if you do that much later, it's like, I don't want to do it at all, because
but it's never too late.
Challenge.
I remember the story that we can keep all the names all all generalized, but of ladies, let's say in their 70s, right? And then you were working with them for a long time, and then after 10 years, like osteoporosis gets reversed. They're lifting weights at Home Depot and things like that. I was like, wow, this is so enlightening.
Yeah, I think that was and I think that's the biggest blessing that I've experienced in this process, is that by changing my mindset about physical therapy, I've developed friends rather than just patients. And that's not to say every patient is a friend, but I think if when you change your mindset about the way you're caring about people, it changes their mindset about transaction with you.
Yeah, true.
So I am very fortunate. I've met, several people who, when we first met, did not think that they were resilient enough. They did not think that they could do, and or even knew what a kettlebell or a dumbbell was. And so I think that was my first. Those two are probably the most pivotal or most amazing nudges that I needed to kind of confirm that, hey, what I've read in the literature and what I've been applying practically is effective. And it's tough.
And I just want to revisit what you just said, because I feel like that's so groundbreaking, is like, the care of the patient isn't about the diagnosis. Right. It's actually about the care itself.
It's about the care.
Which is, what makes you so special in your practice. So
I try. It's the glasses, I'm telling you. You wear it's the glasses.
What brand of glasses is that?
I don't even remember, but...
Okay. Yeah. And the other thing is about, it's about the personalization, like you said, and that person's experience of pain, pain being an experience, not just a mechanical issue. There are motor and sensory fibers, of course, and those go to the thalamus, and that relays things to different areas of the brain. But then the brain interprets this, and then it signals to the amygdala and like different areas, emotional centers of the brain. So we all experience maybe the same potential physical input as something very different emotionally, depending on neural pathways, resilience, childhood history, like all these type of things. So what are the common reasons? What are some of the common reasons that people have pain? And then another kind of related question to that is, if there's pain in one area, how is it connected to the whole body? Yeah. So they're a bit connected.
So I mean, I think common pain or common areas, you'll typically see the most common is low back pain. We see that as kind of, and again, the challenge with low back pain is that it may not be low back pain, right? It might just be the proximity to other areas.
A lot of organs, a lot of tissues are in that area.
So I think proximity is one, but also we've created an environment where anything that happens in the back, we've treated the back as this kind of fragile structure, but it isn't fragile. It's probably one of the most resilient structures and most robust structures. So my job is to try to work on reverse engineering that mindset, that if you have a history of back pain, that it does not mean that your spine is fragile.
Even with fractures, people can heal that.
But I think, like you said, I think the interpretation of pain is really, what we need to address the most with that patient population.
I think, let's say someone has acute back pain, I think the very traditional model was like, take the aspirin, sit on the couch, watch Netflix. But then, is that really a good advice or not?
I don't think it's good advice. For most people, doing everything you can to calm things down, modifying your activities, change positions as much as you can, find positions of comfort. Just like any injury, eventually it will calm down. And again, there are certain instances where, you may need,
if it's severe,
you're getting other signs and symptoms, right? Then yes, it may be an emergent,
neurologic symptoms,
but
all that stuff, right?
And the pain can feel worse than the actual injury, right? It's very, I akin it to a paper cut, right? You can get a paper cut and it feels like it's just awful.
And it might be good for the listeners out there who, maybe don't have that clinical experience as a medical professional like yourself. What are the red flags to look out for, I think most pain, but I think low back pain, since that's the most common. What are the things that's like, okay, you should go see your practitioner about that. You should go urgently to go see someone.
So most of the time, if you have changes in bowel and bladder function,
right.
Definitely, that is not
something called cauda-equina syndrome.
So if you experience changes in bowel and bladder function, difficulty controlling bowel and bladder, that's a red flag.
Right. That's an ER visit, pretty much.
Or if you notice, in some instances, the pain can be severe enough that you notice some changes in, essentially like numbness and tingling in the leg, weakness in the leg. If you notice inability to lift the leg or use those muscles on that side, that again could indicate some sort of compression on those nerves. And again, you may need to go to the emergency room just to have it evaluated and make sure and confirm that, okay, it's this nerve being compressed. But again, it will probably get better on its own with a little TLC, modifying
and
activities.
That's where the diagnosis would be helpful.
And that's where the diagnosis would be helpful. But for the most part, a lot of acute back pain feels really bad. But in terms of severity of damage, that's the challenge, is really how do you calm someone down when they're in the middle of that. And I think that's where the education comes in, and that's where kind of letting them lead with, hey, this is annoying, this doesn't bother me, so if this doesn't bother me, you do that. So the idea is try to calm everything down while you build up everything around it. So you need to continue to increase a level of movement confidence while you're recovering from the primary injury.
And it's so important to address that early, because what I see sometimes is people may either not intentionally ignore it, but it doesn't get really addressed properly. And then what can happen is one area of pain can just kind of go global with that thalamic relay. So it's kind of like you want to address that to get that pain threshold down in a way so that they can continue to be balanced.
Yeah, exactly. And I think that the challenge for so many is that we've created a boogeyman out of the back, right? We've created this mindset. So it does drum up all of the, the excitatory parts of the fear, flight, right? The protection
Got to take
part,
that
right?
Advil Tylenol right away,
And I think I look at pain as also a protective mechanism, right? So pain is also a way to stop you from doing future or undue harm. And so listening to it is important, but it shouldn't be looked at as you always need to turn it off. You don't need to always block the pain. I think if you think of it as a way to protect you, it's protecting you from doing something silly until things calm down.
So it could be a protective message from our bodies.
I've always looked at pain as a protective mechanism rather than a noxious stimuli that needs to be squashed.
In terms of low back pain, just to go a little bit more into that, how would you approach that in terms of as a common pain area as a physical therapist overall? Not assuming it's like musculoskeletal, it's nothing severe, no caudoclinus, stuff like that.
Yeah, I would say that for me, what works really best is to reassure and encourage movement. Reassuring and encouraging movement, whatever that is to you, however often you can do that. Reassuring and encouraging movement is critical in that process, because in order for your brain to make those necessary pathways, it needs context, right? So you need the context around, okay, well, this really hurts, but I can move my arm. Yeah. This really hurts, but I can move my leg.
So trying some things out,
trying
seeing
doing
what works.
Other things that are not, provocative, and they're not going to irritate those structures is key. And whatever that means, maybe that means, hey, I get up every 20 minutes and I try to find ways to stand up taller, or I work on my arms, or I work on my shoulders, or I work on my legs. Anything to stress different areas while that primary area is calming down is a critical nudge forward, rather than, okay, I'll wait until all my pain is at a zero and then I'll start, because that could be several weeks. Right?
And there's a degree of exercise or movement with, let's say, back movements that may change over time as the body recovers. Someone could tolerate a certain, lesser frequency of the movements, and then later on it could be greater, and they have to kind of, that's where that whole tinkering kind of comes into play.
Yeah. I think it's all about graded exposure when it comes to recovery, is that as long as you give just enough of a nudge, your body will make those adjustments accordingly, and it will adapt to those demands accordingly. But if you give too high a dose, then weird things can happen.
So
but
too low of a dose, sitting on the sofa, versus
too low a dose
too high.
is too low.
Right.
Too high a dose is going to be noxious.
Well, you've given me the excuse to do the three bears in the oatmeal story. Not movement, not too much or too little, right? Right in the middle there.
That's right.
Yeah. Okay. Great. That's awesome. So we can talk about and then talking about the root cause of low back pain overall. Why do so many people have low back pain? What are the common reasons? And are there any habits people are doing daily that are contributing to, let's say, low back pain first?
Yeah. I mean, I think most people with back pain, the main challenge is doing something too quickly, or ramping up too quickly in terms of activity without enough preparation.
Maybe weekend warrior syndrome?
Yeah, weekend warrior. But I think most of it, if you think about, our bodies, our musculoskeletal system is all based on capacity, right? Do you have the capacity to tolerate that stress?
Yeah.
And, for some people, they have the capacity to get up and walk, or as high as, deadlift 500 pounds. right? So the strength is one thing. Strength isn't the issue. It's really capacity. And, and that's why there are some people who are sedentary but have no back pain. And there are some people who are sedentary and have back pain. It's not because you're sitting too much. It's just that your structures either have the capacity to tolerate that level of sedentary lifestyle or not. And so that's why it's very varied. And I don't like to use absolutes in terms of, if you sit too much, you'll have back pain, because the problem is that I'm sure we all have plenty of colleagues who sit and they kind of contort themselves in these weird pretzel, but they're completely asymptomatic.
And there are some genetic single nucleotide polymorphisms for like skeletal structure, and people have like different bone masses depending on their person, genetics, family history, and stuff like that.
And I think that's why it's important to look at this as a case by case rather than kind of these broad brush strokes in terms of everyone who sits has back pain, or everyone who does construction has back pain, because that's not real.
The 90% of us in America that have metabolic syndrome, it doesn't help things though.
Right, correct. I think inflammatory responses. I think that's another major factor that, again, I think since I've become acutely aware of that, having worked with CIH communities, that there's just so many things you don't know what you don't know. So I've learned a lot that, some of these conditions may be inflammatory responses from areas that are way outside of my scope of practice.
And especially if it's like systemic inflammation, they have low back pain and neck pain and joint pain and knuckle pain. And
and I usually, and those are the types of patients that are kind of my light bulb moment patients, because typically if you're going to have system-wide sensitivity, it usually indicates it's a more systemic issue rather than a unique, I shoveled yesterday and now everything hurts, as opposed to I'm just I've got back pain because I shoveled last night and now I've got to wait for it to go away. And so I've become acutely aware, or I've started to appreciate more just how inflammation impacts a lot of my patients, especially patients with chronic pain, but also some of my non-chronic pain patients as well. Looking at inflammatory responses and getting an appreciation of those inflammatory markers has been really helpful to educate them too, because it could be an indicator that this is a lot bigger than, you strained your shoulder doing a lift.
Yes, and then another big point would be, another big area or common type of pain, I guess, would be neck pain. The upper back, the shoulders, the traps, SCM, all that stuff. Yeah. What do you recommend in general, knowing that it's not a cookie cutter approach for sure, but with neck pain, so common.
Mean, if the sensitivity is just kind of shows up out of the blue, it's not like, I fell on my head, or I was carrying something. Most of that is really the neck pain and shoulder pain. I look at it more as an endurance issue, right? So it's not necessarily pain, but it's in response to those muscles fatiguing, right? So you're holding these small little muscles that have very low tolerance in the first place. You're holding them in these static positions for an extended period of time. They're getting tired. And what you're feeling is really fatigue, which is why it feels better when you lay down, or you feel better when you take the stress away from those structures.
Yeah, and there's a lot of bowling alleys in our area, and actually we're all bowling every day because our heads are 12-pound bowling balls. Right?
So I think neck and shoulder pain, a lot of it is really, it can be attributed to muscle fatigue, and chronic muscle fatigue, rather than something pathological in nature, and that's why most of the exercises or most of the interventions are really just movement. Just move more. They don't have to be heavy weighted movements, but just moving more out of those positions that you're holding for an extended period of time. But the same adage, though, is that some people have better capacity than others. Some people can hold that bowling ball a lot longer than others.
And there's mitochondrial support.
And mitochondrial support. And also, I think if you have a better, if you don't have the same stressors, right? So stress is also a part of this too, because stress will just elevate.
Stress elevates inflammation,
well.
and
So we know that stress coupled with muscle fatigue in those sedentary positions is going to cause a lot of these symptoms. So my approach to neck and shoulder pain is really a little different than most. I don't like to prescribe, just weighted exercises right away. I usually prescribe body weight movements first for several weeks. And because the other part is also, if you've gotten to the point where you're dealing with neck and shoulder pain, it's not something that just happened overnight. You've worked really hard to develop that. So it's not a matter of just saying, well, if you just do this, you'll be fine. I think you have to create an environment there that lets them identify, this is, in addition to my work, I also need to incorporate this movement that gets me out of this jam. And you don't really have to prescribe 1,000 different exercises. Sometimes one thing, anything to move them out of that position is efficient enough or sufficient enough.
Yeah.
And they can, and once they start to feel the difference, I think that's where the buy-in is really, when they feel the difference, like, oh, well, I used to have that, pain right in between my shoulder blades. Now I do this movement and I don't feel that, or I feel it much later in the day, and it obviously it's not
an improvement.
It's not present in the middle of my meetings, and I'm not noticing it because I'm doing, and all we're doing is just changing the length-tension relationship and just increasing the endurance to a lot of those muscles that are fatiguing or fatigue easily.
And we're about 1.5 years now into this pandemic. I think more people work from home. They're on Zoom. Maybe the posture's not quite right. I haven't met anyone that hasn't had neck and shoulder pain. Actually.
Yeah, I mean, I think that's the true metric of all of this, is that if we get more people moving, I think you'll notice that. I mean, the patients that are that we are working with, I think that's what they notice in the beginning, is that, oh, my pain is not as bad. Right. And again, it's not that you've done something nuanced or something novel. You've just given them an opportunity to change their habit. Right. And that's what we were talking about earlier, is that you've got to get out of their way too, and just let them figure out what works best for them. It doesn't matter if they do it first thing in the morning, middle of the day, or right before bed. They have to establish that rhythm. It's their lifestyle. It's their lives. And if you try to put too many rules in, it becomes more of this kind of battle of wills.
And I love what you say on Facebook sometimes about, like, keep moving, keep active, get going, that kind of thing. Because one of the things that a wise person once told me, and I can remember who they are, but but this idea that if we are moving, we're alive. If we stop moving and we're static, then that's not telling our body that we're alive, actually. So we need to keep on moving. Yeah. Whether, even if we're on Zoom, we should keep moving and things like that. Yeah.
And like you touched upon earlier, though, in terms of improving mitochondrial performance, movement, that's part of that energy transport system, right? If you're not doing enough to create that response, then yes, your ability to mitigate a lot of these challenges becomes harder and harder and harder. And the more sedentary, it fuels that fire. So that's why we want more people to be more active. And whatever that means to you, you just have to move. It doesn't have to be that special exercise that my PT gave me. It could just be as simple as, I've got to prioritize every 2 hours I get up and I just do jumping jacks.
Yeah.
Whatever that is. And whatever that means to you. And I think the goal or the role for physical therapy in this process is being educators, right? And just kind of nudging folks along in this path, and just creating a lifestyle goal rather than, a treatment goal.
Yes, and just a quick point about that from a functional perspective, exercise and movement will basically create mitochondrial biogenesis. The mitochondria being the batteries in your cell producing energy, biogenesis meaning going to create more mitochondria. So literally, you're going to have more capacity for load as you go towards that graded exposure to movement over time. If you do that on a regular basis and you don't do it too little or too much, that someone can really make a great recovery there. Yeah.
And that's the beauty, and I think, for me at least, that's why it's so important that you do give them that time, because those processes take time. They take several weeks to build up, to take several weeks to ramp up.
And so I think, just to summarize that, in terms of we're talking about pain here now still, is there anything people can do at home to address pain in general? What are the things they're not necessarily seeing a physical therapist. Maybe they are. Ideally, they are. But if they're not, what are they doing? Is it keeping moving, or what are the kind of things that you'd recommend?
Yeah, I would. I mean, again, movement. My bias is movement. So most of the time, I will definitely encourage people to stay active and just, the hard thing is the psychosocial component, right? So when you have that much pain or you are limited by pain, it also changes the brain chemistry as well, right? So your ability to feel resilient, your ability to feel robust is also a challenge at the same time. So if you have pain and you don't feel very resilient, it just kind of feeds into each other. And then again, can create a lot of unusual responses, and some of those things we're still learning and still appreciating, how they interfere or how they impact individuals. So I think if you're having pain and you're experiencing intractable pain, then definitely get medical attention. But if it's chronic pain in nature, or you find that sometimes it's there and sometimes it's not, those are usually good indicators that you're either experiencing a tremendous amount of stress coupled with being more sedentary. So just something as simple as getting out for a walk and then just working on, breathing, just getting out, just do something completely off the beaten path. Go for that hike. Go for that one, okay, I haven't been to Great Falls in 2 years. Maybe it's time to go to Great Falls and, take it all in and go, oh yeah, it's still there.
It's a great time to go to
Great Falls. It's
still
there.
Yeah. The waterfall's still there. Sunlight's out there.
But I think a lot of us tend to try to be insular about our pain and say, well, if I just wait it out, it'll get better. If I just not do it, it'll get better.
Yeah.
But there are a lot of things that you can do proactively to nudge that process along.
Yeah. So, well, thank you so much for seeing all these, patients here at CIH, and you've been such a wonderful, boost to the clinic in terms of just like really helping people. Just talking with some people recently about that, and kind of curious how you see physical therapy integrating with healthcare overall, whether it's medicine or nutrition or acupuncture, etc.
Well, I see physical therapy as just an extension of overall healthcare.
Yeah.
I think it's one component, but I think what I've appreciated about working at CIH is seeing how all these different legs play a role in terms of boosting and balance and holding people up. So looking at health, looking at gut health, looking at inflammatory markers, looking at hormonal changes, looking at bone density, and how all of these things affect an individual, coupled with how movement can play a role in that, for me has been instrumental. And I'm forever changed in terms of the way I look at things. I'm forever changed in terms of the way I appreciate the body. Because for a long time, my bias was just movement, right? Exercise, stay active, you'll be fine. But now I have a better appreciation that there are a lot more moving parts and they're all happening simultaneously. And so, an environment like CIH is a perfect environment for a lot of people, because this is one place where that's appreciated across the board, that there are multiple systems being affected and they're all happening simultaneously. They're not happening independent of each other. They're dependent on each other. And that tie-in has been a really eye-opening experience for me, because it does help me have better conversations with patients. I can have better, more in-depth conversations about, hey, in addition to this bone density work, we also know that based on your last lab results, this and this and this is present, which means that we need to be mindful that maybe you don't ramp things up too quickly. Maybe we gradually, maybe slower than what we're doing now. So having that additional information has been really instrumental for them, but it's been even more important for me.
Well, integratively too, supporting all the legs at the table so the table stands up, right? If we had like a 5-legged table and only 3 of them were there, the table would be tilted a bit. So like looking at it from all angles, but also from a person's perspective in terms of lifestyle, we really believe here, we all kind of believe here, right, that, movement and nutrition and sleep and mindset, cultivating healthy relationships, getting out in nature, these are first-line medicine. Yeah,
I agree. I couldn't agree more with you. And I think that in terms of a lifestyle practice, I think I've kind of people have asked me, what kind of physical therapist are you? And I used to try to come up with a novel thing. I'm, orthopedist based or performance based, but for the most part, I'm a lifestyle physical therapist. and most of my patients have very specific lifestyle goals, and my job is to identify how we can disrupt what they're experiencing to start to create a positive response so that they can get back to doing
that
those
makes
things
sense. Most people don't go to the healthcare practitioner to go to them on its own, right? I mean, I suppose there are some people that are like, I want to see Hiza's face every week.
There's some people that want to come hang out with me.
That's true. They can have some tacos with you too.
Exactly.
But a lot of times people are like, how can I become more functional? How's my quality of life? Can I play with my kids, grandkids, hobbies,
Yeah, and I think that's been the best part about this mindset, or the difference in mindset, is appreciating that most people have very specific lifestyle goals, and but they don't know how to start that process, or that they've had negative experiences in the past in terms of starting that process. Yeah, and I think what's different, I guess, what differentiates my style is really I try to listen to the patient and figure out or identify what's the best nudge forward. And sometimes it's do nothing, sometimes it's do a little bit, and sometimes it's do a lot, right? So it's all depending on where they're coming and how they're, interpreting all of this.
I love that word nudge. Lifestyle physical therapy that nudges patients to activate their own healing responses themselves. Yeah. Well, thank you so much for being on the podcast today. But before we conclude this episode here, we have some fun closing questions that we'd love to kind of ask you about. First of all, do you have a morning routine? And if so, what is that, if you don't mind sharing that?
Well, my morning routine, I guess the best way to describe it is, yes, I do have a morning routine, but it's varied. But I have a 3.5-year-old who is a very proactive, early bird, so we're usually up pretty early.
She's your morning routine.
She is my morning routine. But yeah, we spend a lot of time together, and since the pandemic, it's given me a lot of time to reflect of just how important my family is and how important spending time with them is, because we just don't know how much time we have.
That's right.
This was a good reminder.
Family's everything.
So I spend a lot of time with her, and I would like to believe I'm entertaining her, but I don't know.
She's a budding physical therapist, athlete. I can tell.
She's definitely she has a garden that she lets me tend to sometimes. I only carry the water. I'm not allowed to touch the plants, but I can carry the water because.
What kind of things is she growing in that garden?
She's growing carrots, and she grew bush beans. She grew kale. She grew peppers, red peppers. She grew everything, herbs, lots of herbs.
Most organic, of course.
I hope so. I don't know. Fingers crossed. I don't know.
Yes. All right. So getting up early, kind of doing some movement with her. Yeah. And what book or podcast are you enjoying the most right now, would you say?
I think the book that I'm constantly reading, which was published in 2015, is the Pain Handbook. It's the Protectometer. Mm-hmm. But basically, it looks at how pain is really, it's more of an emotional experience rather than this kind of, binary thing, right?
Yeah, absolutely.
And so it's given me a lot. Because like I said, based on the previous question, with a 3.5-year-old, it's very hard to dedicate too much time to reading. So most of my readings are journals and research articles. And,
you said the pain.
The Pain Handbook.
Handbook. Okay.
Yeah.
Okay. Thanks.
Underneath is called the Protectometer.
The Protectometer. Got it. Okay. Thank you.
But yeah, so that's. I read that from time to time as just kind of reference, and it's been a really good reminder for me that I don't need to look at pain as this kind of binary, like is there an injury or no injury? Because most of the time you can have pain and not have an injury and still experience pain.
Got it. And then, thank you. What do you do every day to cultivate joy? Tending to the garden.
Yeah. That's not joy for me. That's work. That's labor.
That's work. Okay.
That's labor.
All right. So after the work is done, right?
After the work is done.
Right.
So I do try to prioritize exercising and just finding time to do an hour or two just to myself, and sometimes that's late night, and sometimes it's early. But I also, seeing my daughter do the things that I enjoy doing and having as much fun as I'm brings me joy. So it's been great to see that, my wife and I are passing on at least the mindset that exercise and being active is it doesn't have to be forced. It's just a lifestyle. It's just part, just like you brush your teeth.
It can be fun.
It can be fun.
That's great.
But so that's for me. My family brings me joy, and doing. And being a part and annoying them with all my PT jokes and now that I'm a dad, I can crack dad jokes. So I've been I feel very blessed now that I can finally crack corny jokes.
Yeah.
And then
do you have any PT or dad jokes in the cupboard that you want to share on air, or
no,
is that
not yet.
maybe
no.
off air?
Well, off air, definitely off air.
Right. All right.
Listen, these people have to have some respect for me. Not just
we'll do this after the podcast
after
ends.
The podcast.
Yes. All right. Well, thank you so much, Hiza, for being here today on the podcast. It's an awesome episode here, and thank you so much. And how can listeners learn more about you and work with you?
The best way is either through CIH, my information is there, or you can go to Kimbia Physio, KIMBIAPHYSIO.com, and you can find me there as well. You can connect me through that. So
Great.
Either CIH or through my website.
And Kimbia, I will ask you this because I was going to ask you this. That reminded me. Kimbia, how did you get the name for your clinic there?
So Kimbia is Swahili for running.
Running,
so to run.
Okay.
Yep. So when I first started, I was working primarily with endurance athletes. So I started working with like runners and cyclists. Started to come in, and then they would say, hey, I've got a swimmer friend of mine, and so then it just kind of grew, and then it went to, well, I've got a postpartum athlete who wants to, so then it kind of just grew into a bigger thing. So the initial mindset was I was just going to work with runners and runners alone, and then it grew and it grew and it grew and I've had to expand it. But I like the idea of running because it's a constant struggle to just stay active, and I think we all have that struggle, and I think we all have the ups and downs and the side steps, and progress is never always linear. This nice, lovely linear curved line that we all think about. It's squiggles, lots of squiggles.
A lot of squiggles. Yeah. And keeping moving. For sure.
Keep it moving.
Well, thank you so much again.
I appreciate it. Thank you for having me on a Friday. The first Friday
guest.
Friday oh, man. Whew. Good luck, everybody.
Well, thank you so much for taking the time to listen to us today. If you enjoyed this conversation, please take a moment to leave us a review, rate us, like us. It helps our podcast to reach more listeners. Don't forget to subscribe so you don't miss out on our next conversations. And thank you so much for being with us today as well.